So now we'll get into the head bobbing or grunting. You can also see retractions with this one. So you see those retractions on the very bottom as well. As he's grunting. And doesn't sound good. Oh, there we go. Okay. So in that one, that's probably the worst wheezing I've ever heard, and which is why I wanted to point this one out. But it's a lot more subtle usually. But you also notice with each of these kids, you also see that increased work of breathing for each of them. And so we went over the wheezing, and then there's also some
cyanosis is a blue skin color. You can usually see it around your baby's lips, chest, and stomach. This blue color means that the oxygen level in the blood may be too low. Cyanosis may mean there is a problem with the baby's lungs or heart.
And so in so you see any of these types of signs, you definitely want to have either your main pediatrician or come to the emergency room to have them evaluated. Next is croup. So croup, this one is a swelling of the back of the throat, and this narrows the airway. And then when you hear this one, you will hear more of a what we call stridor. It's when they breathe in, it's almost like almost like a whistling almost. And that's because the airway is narrowed and it's hard to get air into the upper portion of our airway. So have a listen here. So I forgot to mention also that there's that distinct barking cough. It kind of sounds like a seal. We call it a seal cough. And that's all because you have that inflammation in the back of the throat. What's interesting is sometimes cold air or cold beverages can even help. I had a kid at primary children's where he was 6 years old, had really bad croup, where to the point where he would breathe in and it sounded like he was not doing well, but he was totally normal. But I was really nervous because he kept wanting to talk to me, and I'm like, okay, kid, you're kind of making me nervous because you're just showing me that your airway is very, very small right now. But he kept wanting to talk. I brought up, hey, we do have slushies, and he just perked up. He was so excited, and I was gonna go have some of our individuals that help us with respiratory illnesses give him some treatments that we do for croup in particular to help kind of ease that swelling at the back of the throat. And I came back a little while later, and he was perfectly fine, didn't have any sounds to him whatsoever, was totally normal. I'm like, what in the world happened here? And they didn't use any treatments or anything. I'm like, what was the trick? And they told me it's like after he had that slushy, he downed it first off, and then second off, and then he just got better. And that slushy kind of temporarily helped kind of soothe the back of the throat, that inflammation, and help tone it down to where he was able to see some improvements with his condition. And after that, that is the story of the magic slushy, as I call it. And so now whenever I have kids with croup, I recommend, hey, let's just give them a little bit of a slushy to kind of help things out. You also you want to keep them very calm because it can make, when they get mad and agitated and like really crying, that can make things worse to where it can really cause them difficulties with their breathing.
Yeah, this is one of the rare situations where parents, when their kids are sick, are usually like trying to protect their kids from cold weather and from being too cold, which makes sense. But croup is the one exception to that rule. Like if they wake up often croup will present in the middle of the night, or the kid will go to sleep and then they wake up 2-3 hours into the night and they're suddenly having this barking cough and this like whistling noise when they breathe, and it can be really scary because it's the middle of the night. So take them outside into the cold air if it's winter time, it's okay. That cold air actually helps for air to get into that narrowed airway. Or open the freezer door and have them breathe in like the cold air from the freezer. So this is like the one time where you can expose them to the cold. I mean, obviously not their body, but like the breathing the cold air can be helpful.
So some risk factors that we have, and this is why it's so important to try to prevent and like treat things the best that you can. Very young individuals, so we're not able to get certain vaccinations until 2 months old or even 6 months old. And there are also very premature babies that they have very immature immune systems that are and underdeveloped lungs quite often, well, almost all the time. And that can lead to very bad outcomes with basic respiratory illnesses. Those with disabilities have other issues that they're dealing with, whether it's heart problems, other lung problems. There's all these different medical conditions that they can have that these viruses can just work overload on them and cause even more issues. And one of the particular ones, particularly for Blacks, Latinos, and minorities, is asthma. There are higher percentages of individuals of minority groups that have asthma. And it's one of the disparities in medicine that these viruses can really cause a lot of problems for them. I see a lot of individuals who get a common cold, but they have asthma, and it just exacerbates their asthma to where they're needing to come into the hospital to help them breathe. And so being very mindful of these types of individuals and making sure, let's stay ahead of the game. Let's do our best we can to prevent and also treat. Then you have on the adult side of things, very old individuals, similar to young children, like their immune systems are reaching there and they're just not as good as they used to be. Pregnant women, as well as like the immunocompromised, or those that are receiving immunosuppressant therapy, like those on transplants, those with cancer, their immune systems are practically shot. And so it's one of those things where it's super important that we are able to do the best we can to prevent and like treat these things, which leads me to what do we do to prevent? Immunization's huge. Influenza vaccine can be given annually for anyone over 6 months. Getting vaccinated during pregnancy is incredible as well because that helps the baby. It transfers a lot of antibodies into the baby. And then, we also have the COVID vaccine, which over 6 months of age as well. And then we recently, in the past, I think, year, had an RSV vaccine that mothers can get when they're pregnant that it's a game changer. It takes place between week 32 to 36. Moms can get it. It gives immunity, or not immunity, but it gives those antibodies and a huge increase in their immune system for up to 6 months to that newborn baby, which is incredible because with RSV, we see that those 6 months are where you can have the worst outcomes when it comes to RSV. And
Or
then,
the baby can also get the vaccine. So if mom chooses
oh
not to
yes,
when she's pregnant, baby can get it
right.
in the first couple months of life. Up to if the baby is 8 months or less during RSV season, basically, they can get it.
That's right. And then there's also it's called DTaP for babies and children, but the Tdap shots that protects against pertussis if we're just focusing on respiratory, which we're seeing numbers that we haven't seen in over a decade, and it's what causes whooping cough. So whooping cough numbers, I've been exposed to it. I've seen people with it. It can be really devastating, particularly to young babies and very worrisome. And so that's another thing, another vaccine. Not only that, though, is hygiene. Teaching your kids at a young age, hey, wash your hands, soap and water. That's even better than um, rubbing alcohol or like hand sanitizer. That's what I was looking for. And so using good, proper hygiene, which it can be difficult with kids because they are just not hygienic and they're doing things that you just makes you wonder. But trying to teach them those skills to help them and establish those habits. Also avoiding and touching your face and teaching kids to sneeze into their elbow or into their hands help reduce kind of that spread. And then, you know, reducing exposure when you're sick sick or you notice individuals are sick, like don't have them come over to your house. Avoiding, it's easier said than done, especially when you have like daycare and stuff, you're not sure, but trying the best you can, like keeping sick children home, avoiding exposure to smoke, air pollution, which is so hard to do here in Utah during the winter months, but trying the best that you can. And then when it comes to treatments, they're very limited when it comes to the um, viral illnesses because you cannot treat a virus with an antibiotic. But there is what's called Tamiflu. It's an antiviral that we can use for the flu. It reduces the duration and the severity of the flu, but it doesn't actually cure the flu. And so if it's given within the first 48 hours, once you start having symptoms, you can actually see improvements by about 2 days or so, which, the flu, it's miserable. Even 2 days, that sounds great.
Yeah, let me add one thing I was going to say about. Oh, yes. So one of the things that I see most commonly that contributes to more kids getting sick and spreading illnesses in daycares and schools is that parents, it's totally understandable. It's really hard for a parent to like take off work in order to take care of their kid, pull them out of school, pull them out of daycare. That's a really tough place to be. But too many parents I see, their kid gets sick, they have a fever all day, then they wake up in the morning and they don't have a fever and they look better and they send them to school or they send them to daycare because they're like, oh, they don't have a fever anymore. And then either in the middle of the day, they cycle with the fever again, or the next night they cycle with the fever again. The safest practice is to wait until your kid is fever free without medicine for 24 hours and feeling better. That's kind of my general rule of thumb of when to send a kid. Oh, you were going to talk about
Sure was. You beat me to it. No,
yes,
it's great because that's
sorry.
huge.
Go ahead, take it away.
No, no, no. You nailed it right on the head. When can my kid go back to daycare, school? It is that free of those big symptoms such as fevers, vomiting, diarrhea. Wait until they have been good for 24 hours. Also improved energy level, making sure that they look halfway decent. And other daycares, they might have other like rules for when they can return, but that's just kind of a general rule that I tell individuals: 24 hours away from fevers, as well as like those big things like vomiting, as well as like diarrhea. And then yeah, and then one thing I really wanted to go back to is like why preventing these types of things is so important. It's because we see huge numbers of these like respiratory infections. It's estimated between like 58,000, 80,000 children are hospitalized due to just RSV alone. I see tons of them. And so infants in particular, they're at the greatest risk. But then we also see children younger than 5 with influenza that can be complicated. And it's about protecting our kids. We want these kids to be healthy, and it's miserable seeing your kids sick. I hate when my 2 kids are sick. It's because you want to just take that from them. And so it's just so important. And vaccines are one of the best things we can do. There are so many changes we've seen in particular with vaccines since they've been initiated. For example, one of the coolest things is like the smallpox vaccination. There was an estimate, it was about 300 to 500 million people died from it during the 20th century. So that is a huge number. But since 1980, they started the vaccination. It's by the World Health Organization, big organization that says, hey, it has been eradicated. It is not here anymore because of the vaccine. That's just absolutely incredible to me. But not only that, is there other things that are so preventable utilizing these vaccinations, like measles, that can cause so many problems. Polio is a good one too, because that one can cause paralysis, death. We've seen numbers decrease by over 99% since the vaccine came in the 60s. And, it's just so incredible to see how many lives these vaccinations have been able to save. And, that's why I always recommend to individuals, go and get vaccinated. If you have reservations, talk to your pediatrician. Look into really good resources that I'll have some resources at the very end that you can go to look into like the importance of these vaccinations and hopefully answer your questions.
Yeah.
So then, and just last thing is like common myths about these viral illnesses. So first off, flu shots, those vaccines that actually get you sick because they're made from those same pathogens or like those same viruses. They're made from what's called a like a dead or a weakened virus as well. They don't what you're feeling when you're feeling sick and like you do kind of feel crummy. It is your immune system kicking in. It is the body's response to protect you later on and give you that help when you do encounter the real thing so that you can have a better response and not get as sick. And then going into like cold weather causes, it's not exactly that cold weather causes it. It does drive you more indoors. It does drive you like it dries out your mucous membranes and things like that to where it's easier for them to get into your body and start messing with things. But it's not the cold like my granny used to always tell me when I was younger. It's like you go outside in the cold with no sweater on, you're gonna get sick. That's really not the case, Granny. And then like we had talked about earlier, antibiotics don't treat viruses; they treat bacteria. So these viruses they are not cured by these antibiotics. Oftentimes people will tell me, oh yeah, but I had a cold and I got some antibiotics and like amoxicillin and I felt better. Typically, well, probably what happened was you had a viral illness and you took this medicine that wasn't doing much, but it ran its course while you were doing that. But you thought it was medicine, where in reality, it was most likely the fact that it just kind of ran its course. And then I also talked about like hand sanitizer versus soap. Soap is the way to go. And then these viruses build lifelong immunity. That is also incorrect for the most part. Some viruses like the measles, you gain immunity. That's why we give a shot for the measles. But most of them they are able to mutate. That's what's interesting about viruses. They mutate and they're able to change their structure so that particularly like the cold. The cold is a really good one. I think when I was in med school, there were like 600 different variants and they just kept changing. I don't want 600 shots for all those. So it's just impossible to be able to keep on top of some of them. But so some, yes, others, not so much. We have vaccines for those that you do gain lifelong immunity from, and others, you just got to let them run their course. So getting into now our last question of the day and the end of our presentation. But what are retractions?
And while people answer that, I like Dr. Ferguson's comment in the chat that some antibiotics actually have an anti-inflammatory effect. So azithromycin, also commonly known as a Z-Pak, has a notorious anti-inflammatory effect. So that's why sometimes people feel better because it's just kind of soothing your lungs. It's soothing the inflammation in your airway and your lungs. But it's also it's helping you a little, but it's also really messing with your gut bacteria, and that can have really long-term consequences. And it's basically killing off some of the beneficial bacteria in your body, in your gut, which can lead to more prolonged side effects. And we have some answers. So drawing back of breath from Lucy. Lucy, you're on a roll today. So very good.
Are we allowed to give her two?
I don't know, Dr. Ferguson, what do you say?
I don't
know. One right answer per question.
Okay.
Per person.
So speaking of that, we need the previous. So Melissa needs to put in her email address as well. She got the last question.
And I think we still could go for a correct answer for what are retractions.
Someone could just copy Lucy's answer, which Lucy's on top of things. I'm gonna put an answer in here pretty soon.
Well, I think you guys did a great job. You two did a great job tonight. Maybe we'll do a part 2 for the spring. We can go over asthma, hay fever.
Yeah, that'd be great. Oh, and Russell answered. Thanks, Russell. When the muscle.
There we go.
Very good.
All right, very
That's
good.
a retraction.
Write in your email or send it to one of us and we'll get you your reward. Thank you, everyone.
Awesome.
Thanks for listening. Thanks. Sorry for going over a bit, but hope this was helpful. And here are some resources from Dr. Holloway.
So excellent resources. I utilize some of these for today, and then I have my references as well. But these are really, I love the general pediatric guidelines for my healthy children or healthy children. Oh, I messed that one up, but phenomenal. CDC has great stuff, good vaccine stuff as well. So wonderful resources. And then, yeah, thank you all so much for coming. It's a pleasure being able to talk with y'all and teach y'all on these things.